thank you all for being here for the Lubbock Public Health MMR Vaccination News Conference today. My name is Lacey Nobles. I work for the City of Lubbock as the Communications and Public Engagement Director. I want to thank our panelists today, and we are joined by several members of our medical community. We have Covenant Health, University Medical Center, and United Supermarkets, and we thank their support in being here today. So I'm going to go ahead and turn it over to Dr. Catherine Wells.
Good afternoon, everyone. I was going to just give a quick update where we are with our measles outbreak here in West Texas, and then we are going to turn it over to one of our local pharmacists and some of our local physicians to talk about the importance of getting vaccine, especially the MMR vaccine, in our community, and also why we are changing the recommendations of vaccines here locally because of the cases of measles in our community. So this measles outbreak actually began back in January 2025. For a lot of us that are working on the ground, operating our hospitals, our public health system, it seems like it's been here for 6 months or a year. There's a lot of people working in our community tirelessly to both treat and help individuals in our community, and then also all of the surrounding community that depends on Lubbock for its medical care. Those first two cases were identified in children from Gaines County who were hospitalized in Lubbock, and that's really when we first understood that there was a measles outbreak occurring here in West Texas. These marked the first confirmed cases of measles in the South Plains in over 20 years. We have not had to worry about a case of measles. We've not had to worry about an infant getting measles in the South Plains. We haven't had to worry about an unvaccinated individual showing up with measles because we haven't had it circulating in nearly 20 years. Many of our physicians had never seen measles before. It was only something that you'd read about in textbooks. Since then, that outbreak is now spread to over 23 other counties in Texas. We now have cases in El Paso associated with this outbreak. We have cases in all of the surrounding counties in West Texas, and even as far up in Dallam County, up along the Oklahoma-Texas border. The outbreak has also crossed state lines with more than 100 additional cases associated with this in Oklahoma, New Mexico, and Kansas. Because of this ongoing outbreak, on April 7th, the Texas Department of State Health Services expanded their designated outbreak zone to include Lubbock County. And what this means is that for Lubbock County residents, we're changing the recommended vaccinations are changing for both children and for adults. The biggest change with this is that we are now recommending that children as young as 6 months of age start receiving the MMR vaccine. And this is because we have transmission within our community. When we first started seeing measles cases, public health or the hospitals could always tie that to some type of medical exposure or an exposure within a home. Since then, and especially over the last 2 weeks, we've seen outbreaks where people are coming down with measles and we don't know where they got it from. They are not in close contact with a specific individual known with measles. We've also seen an outbreak in one of our daycare facilities, and that just means that our most vulnerable individuals, young babies of working parents, are now being exposed to measles. And us as a community really needs to work to increase our vaccination rates so that we can really protect those vulnerable young children that aren't even eligible to get a vaccine yet. And in addition to Lubbock County being part of this outbreak zone and these recommendations, this is also applying to other counties in West Texas, including Cochran, Dallam, Dawson, Gaines, Garza, Lynn, Lamar, Lubbock, Terry, and Yoakum. So anybody in those counties, it's now recommended to get these new vaccination or follow these new vaccination guidelines, and that can be done by a physician or a pharmacist in your own county, or if you're here in Lubbock, you're welcome to get that vaccine at our health department. And the specific vaccination recommendations are that for children 6 months to 11 months old should receive their first dose of MMR. This is an early dose, and then they should follow that with an additional dose after they turn age 1, and then they'll still need a third dose before they go into kindergarten. And then for children over 12 months old that haven't been vaccinated, we're recommending them to go ahead and get their first MMR vaccine and then go ahead and get their second MMR vaccine early, 28 days after their first. And then we're highly recommending that any teen or adult with no evidence of immunity or no vaccine history to go ahead and get their first dose of the MMR vaccine and start that schedule. And then there's some different age groups of individuals that have gotten their original vaccines in the 1950s, 60s, and 70s, that there's an additional dose recommended, and those details are on the health department website. With that, I'm going to go ahead and turn it over to Crockett Tidwell, a local pharmacist, to talk about some of vaccines and how they work.
Thank you, Catherine, and thank you, everybody, for joining us today. First thing I like to talk about with my patients that might be a little hesitant is, hey, this is what a vaccine is. This is what a vaccine does to you and why it's so important. And really, you need to have a small understanding of the body's immune system. So God gave us an amazing immune system. It's strong. It can combat almost any disease that is out there. But, and there's a big but, your body's immune system is very discerning, and it's discerning on purpose. So it recognizes the good from the bad, and that takes time. 10 to 14 days is a good rule of thumb after you're exposed to something before your body builds the immunity to really fight it. Now, in the meantime, you're exposed to an infectious disease. That infectious disease enters your body and it immediately starts multiplying exponentially. And exponential, sometimes you think, okay, 1 becomes 2 becomes 4. But in the case of a virus, 1 becomes 1 million, becomes 2 million, and before you know it, you have trillions of viruses. That's all happening during that 2 weeks when your body's immune system is learning to fight it. It takes an education. That's where a vaccine steps in. A vaccine, think of it as an education for your immune system. A vaccine is designed to show your body exactly what the disease looks like without making you sick or without giving you that disease. So you give the vaccine, 10 to 14 days later, your body's immune system knows what it looks like. Well, what does that do for you? You're exposed to a virus or an infectious agent, and at that time, your body's immune system already recognizes it, brings its full force to it when it's in your body and still small before it has a chance to expand. So, in other words, it keeps you from getting real sick. You still might get a little bit sick, but remember your body's immune system now knows what it looks like and it's ready to do battle. Okay. Now, take a couple of steps back and think of our community as an organism or as your body. The more people that are immune, the more people who have an educated immune system walking around is less likely to come in contact with someone who may have a naive immune system or people that have a weakened immune system. So that's why it is so very important to have high vaccine rates in our community, because it's less likely we're going to affect those people that don't have that educated immune system. So that's what I have for you guys, and thank you for listening. Dr. Ron Cook.
Thanks, Crockett. I'm just going to go over kind of how measles presents, and then I'll talk to you a little bit about why we don't give vaccine earlier than 12 months in a usual case. Okay, so this virus, let me just start off with, overall the Lubbock vaccination rate for MMR is about 92%. We need to get to about 95% to have this herd immunity. Because we're not there yet, it's going to spread a little slower because we have a pretty high rate, just not high enough. It's going to spread a little slower, except in those very patient populations that are very vulnerable. So those that are not fully vaccinated, those that are not immune competent, or those individuals that are under the age of 12 months. So we're about 92%. We need to push that up a little bit higher. So this virus is so infectious, one of the most infectious viruses. You've heard all this before. And so it takes, after your exposure, you're completely asymptomatic, having no symptoms for the next 10 to 14 days, and then you come down with this pretty high fever. That fever may be so high that you actually might have a seizure from it, and that's not uncommon, but it's not an epileptic seizure. It's seizure related to how fast that fever climbs. And so from there, in a few days, after you get this fever, you start getting a sore throat, a runny nose, and really these really red and inflamed, painful eyes. We call that the cough coryzon conjunctivitis. Shortly thereafter, you get the spots in your mouth, what we call Koplik spots, little shallow ulcers that are very painful. But that's just the precursor to what's about to come, because it's going to spread out throughout the body. Those little ulcers go into lungs, and then we get this virus spread about the whole body. And then in a couple of days, you get a rash that's typically starts on the scalp, the hairline, and it comes down the rest of the body. And then you start healing from all the damage that the virus has done in the body, and it likes the respiratory system the best. You do get some gastroenteritis, the vomiting and diarrhea stuff, but it's really inflammatory to the lungs, and that's where we see a lot of the problems with these children or adults that get it too. From there, but here's what I want you to get out of this. You're most contagious with this virus from 4 days before you get the rash to 4 to 5 days after the rash. We start day 0 with the rash, so you got to go a full 24 hours. So 8 or 9 days you're infectious, spreading this highly infectious, one of the most infectious viruses to everybody around you. And some of that early on, you don't know that you're infected. And so that's what we want to try to stop and keep those patients or those individuals who are highly susceptible to this. And that's where I want to talk about why we lowered the age to give this vaccine. So when an infant is born, the mom, if she's immune intact, she's had the MMR or she had measles as a kid, she crosses over, she gives through the placenta and through breast milk IgG and IgA, which help prevent and protect the newborn infant. And so those antibodies last till about 6 months of age. And then after that, they start waning a little bit. They start falling off, and they don't protect as much. And so because we have a vulnerable patient population, like in our daycare, if they get into daycares, we really start worrying about those individuals. And so we give an early dose of this vaccine to help prevent it. If we give it too early, before 6 months, the maternal antibodies that the mom gave the infant fight against the vaccine, because they see that as foreign, because it's a live vaccine. And so it's fighting against it, and we may not have the immune response that we need under the age of 6 months. So that's why we have to wait till they're 6 months of age before we give that vaccine. And if we give that vaccine somewhere between 6 and 12 months, they still need to have 2 additional doses to be fully vaccinated at 97%. So that's that's why we've lowered it, but that's why we don't give it before 6 months of age, because the maternal antibodies are going to fight against us. Let me just talk a little bit how safe this vaccine is. We've given over 15 million doses in the 50 years that this vaccine has been available. It's very, very, very safe. There have been no associated deaths with this vaccine that the CDC has investigated. Now, some people may report deaths, but it's not been related to the vaccine. It's unfortunately and untimely that somebody else may have passed away from it, but it hadn't been associated with the vaccine. So in that amount of time, in 2024, we had 9 deaths in the United States associated with the measles, not the vaccine, because we've been given millions of doses. But in 2024, we had 9 deaths associated with measles. We've already had 3, 2 here in Texas and 1 in New Mexico, a death. That's a pretty high rate, really, from the number of cases that we've had already. The potential for the outcome is very poor, and the patients die from that. So there are individuals that do get the vaccine that have some reaction to it. Normal reaction to any vaccine, because it's your immune system responding to what we just put in it. So you're going to have soreness. You're going to have some muscle aches. You may have some high fever, and there's rarely a febrile seizure associated with that. But those are pretty rare, and it's very treatable. And so, and then one thing I need to bring up, 10 days to 14 days after you get the vaccine, you may get a rash. You are not infectious, but that's a very common side effect. I get this phone call all the time in my parents that we give the MMR to. Oh, my baby's got a rash. Did you give them the measles? No, I gave them the MMR, but it may cause a rash, so that's okay. It's associated with the vaccine, but it's not infectious. So I'm going to stop there. And let me just say, it's a safe vaccine. Please come get it. Overall, Lubbock is doing pretty well, but we have pockets of individuals that either can't get it or are immunocompromised and are under the age of 1 year of age. So we still need to get that vaccination rate pushed up because it's the best thing to do for our children. All right, Dr. Montanez.
Hey, good afternoon. My name is Ana Montanez. I'm a general pediatrician here in Lubbock, Texas, and I've been practicing as a general pediatrician for the past 7.5 years, so I know a lot of the community families and children, and I'm just going to briefly talk about some of the treatments that we have for measles. I'll be very brief because there's no treatment. But I do think it's important to understand the difference between symptoms and disease, right? Because measles is the disease, and we treat symptoms like cough, runny nose, pink eye, fever, but we're not necessarily treating measles, right, the disease. And I think it's very important to understand that when we think about what we have available for children and patients who come down with measles infection and disease. The guidelines for measles treatment really mainly focuses on managing symptoms and preventing complications related to measles. There is no specific antiviral treatment for measles. Okay, so I'm going to say that again. There is no specific antiviral treatment for measles. Now, what we do know is that we can treat symptoms, and the body's own immune system will essentially have to fight off the disease itself. Now, once a patient becomes infected with a wild-type measles, that means not the live virus vaccine, but the virus itself, that leads to the risk of several complications. It can lead to pneumonia, it can lead to encephalitis, which can be inflammation and infection in the lining of the brain. It can cause other damage like deafness. It can cause impaired cognitive function. And what we do know is that after being infected with the wild-type measles, there is a very rare but very serious complication that can occur once a child or a person recovers from their wild-type infection. And that's a subacute sclerosing panencephalitis. Okay, that is very deadly. That tends to occur about 7 to 10 years after the infection of measles, and there is no cure for that. It is deadly. And the way to prevent all of this from happening is to be vaccinated, okay? Now, some of my patients that I care for, because I don't just care for Lubbock community, but also in Gaines County, some patients have attempted to use vitamin A to treat and protect from measles. And a lot of them have chosen to forego vaccines and choose vitamin A. That can be very dangerous. Vitamin A is a fat-soluble vitamin. Once it's deposited within the body, it can slowly elicit more and more levels of vitamin A that can cause serious complications. Okay, they can damage the liver, but they can also damage the brain. So vitamin A is not a treatment for measles. It is not protective against measles. The only thing that is protective against measles is the MMR vaccine. That is proven to be safe and effective. It provides 97% protection. Hardly anything guarantees you 97% protection. So my encouragement is for everybody to check their vaccination status. And if you have any question at all, whether your child or yourself are not vaccinated, please reach out to us. We are only a phone call away, and we have the vaccine ready to administer to you. Okay? The last thing I want to leave with you is that it is our shared responsibility as healthcare providers, as educators, as leaders in public health to provide accurate information to our families so that they make educated, well, healthy decisions. And that is what we're here for. Thank you.
Thank you all. We're going to open it up to some media questions. So if you just stand up and state who you're with and your question.
Hi, Cameron Mendoza with KNOC, KLBK News, and everythinglubbock.com. Dr. Wells mentioned infectious control at the last public board health meeting coming here, and with the CDC, they did a bunch of trainings and kind of helped you guys, I guess, understand how it was maybe spreading. How has that kind of looked now that has happened, and has it done anything as far as hospitalizations or stabilizing that?
Yeah, so at the last Board of Health meeting, we were talking about the infection controls consultations that we were receiving from CDC. And what they were able to do is go into, say, a physician's office and help evaluate the risk to other patients that might have been in that physician's office at the same time if there was a measles case. So guidelines say that if somebody in this room had measles, we would say that for the next 2 hours, anybody else that walks into this room would be considered to be exposed to measles, and if they weren't vaccinated, they would need to quarantine and isolate and watch for symptom development. Allowing the consultation from CDC allowed us to have a better understanding about airflow, some of the other things that healthcare can do to help eliminate that risk and hopefully turn over rooms quicker in our healthcare facilities. They were also able to provide consultation for us with the daycare exposure, help us figure out how airflow worked in that facility and which children were at greatest risk and who really needed to be sent home. So great to have that expertise on the ground.
With the Lubbock Hour Journal, how many MMR vaccines has the health department administered since the start of the outbreak here?
We've administered over 450 additional vaccines than we would normally through our regular clinics. I've also talked to other physicians, and I don't know if Dr. Montanez wants to say anything, but I've talked to other physicians on the ground. I've talked to my child's pediatrician, and she said that they've had lots of phone calls, lots of children coming in for that nurse visit to get the vaccine. So you can get the vaccine here at the health department, you can get it at a pharmacy, you can get it at your pediatrician's office or a primary care doctor. So it's really available in our community.
Parker Schaufner with KCB. You have said that our measles cases are underreported. Is there an estimate as to what percentage of cases go unreported, and what is being done, if anything, to improve that?
Yeah. When I talk about underreporting of measles cases, it's usually around the outbreaks within Gaines County. If you're a parent and one child's sick and it's the flu, you don't necessarily go running out to the doctor's office to go get the other kid tested for the flu. So I think same thing with measles. If you know it's measles, you're able to control that at home with Tylenol and different over-the-counter medications. There's really no reason to go out and get tested. There's nothing that requires you to get tested, so that's why we believe there's an undercount.
I have a question from CNN.
One of the speakers mentioned 9 deaths in the United States associated with the measles in 2024. Is this true, and can you clarify that statement?
You said 9 deaths.
Did you say?
So that's the CDC report. That's overall across the United States. With those 9 deaths, I don't have any knowledge about those particular deaths. All I know is what we've had in our region, the 2, and then the 1 in New Mexico. And so that would definitely related to measles. And to answer your question about the number of deaths, the number of deaths predicted to measles given historically is 1 to 3 deaths per 1,000 cases of measles. So when Dr. Wells talks about underreporting, if we've already had 2 deaths, a third in New Mexico, potentially there's 3,000 cases that are underreported, and we have 561, something like that. So there's a lot of underreporting because many patients don't show up to get treated. And so, but it's the number of deaths associated with the vaccine is 0. So this is a very preventable disease. So please get vaccinated if you haven't, or you have somebody between 6 months and 12 months, or in another high-risk category, please.
Okay, I think that I have a question for Dr. Montanez. This is from iHeartMedia. He asks, I'd like to ask a question about reports that anti-vaccine activists have been working with members of the Gaines County community and are prescribing unapproved treatments for measles, such as vitamin supplements and medicine that's normally used to treat asthma. My question is, how is this playing a role in the continued increase in both identified cases and deaths, and what is being done to counter their anti-vaccine misinformation?
So that is our biggest nemesis, right, is misinformation, at least from, healthcare perspective. I struggle with that every single day with almost every patient that I see. And so that is why I really think it is our responsibility as a whole to continue to echo the correct information that will help families keep themselves safe, healthy, and protected, okay? Because, an ounce of protection is worth way more than a pound of cure, which means if we can prevent something from happening, then we're all the better as a community, as a family, as an individual. Countering the misinformation put out there about using vitamin A for treatment of measles has been a struggle, an upward struggle. However, I have found that once I sit down and talk to those families and explain to them that the dosing for vitamin A needs to be managed by a healthcare professional. It is not something that you get over the counter and give to a child whom you assume has measles. It is definitely not something you buy over the counter and administer to a child to prevent them from getting measles. And once I explain that, then more questions that they didn't think they had start to arise. Like, well, what is the dose of vitamin A? How do I get it? What is in cod liver oil? And I think given the opportunity and given that information, I really, truly believe that they will make better decisions, safer decisions.
We've got time for 2 more questions, if anybody has any more.
I'm not sure if this could be addressed by Dr. Montanez or Dr. Cook or anybody, but the second death was confirmed. That child had died of measles pulmonary failure. Can you kind of go into what, maybe the signs of that will look like and how bad it has to get to that point?
So I'm not an inpatient hospitalist per se, so I wasn't involved in that particular case. I have taken care of a lot of intensive care patients who do suffer from respiratory failure, and so I can sort of speak on some of the signs and symptoms. The definition of the of the death, measles-associated pneumonia, respiratory failure, again, if we think about the difference between disease and symptoms, then you can kind of see that the disease was measles. The symptom was respiratory failure, right? And that's triggered by the disease. Respiratory failure, by definition, means that our body starts to fail, our lungs fail. Our lungs are important in gas exchange, bringing us oxygen. All of the cells in our body need oxygen to function. And once that system shuts down, then essentially every single cell in our body becomes starved of oxygen. And it ceases to function. Every cell has its own function, and everything begins to shut down. We can try to help and support that system until the body's own immune system recovers, and that would be with supplemental oxygen, either via nasal cannula or maybe intubation, something called nasal CPAP. All of those are just sort of Band-Aids to kind of help provide oxygen to the body as the body itself tries to recover from the disease. So dying from respiratory failure is a struggle for the patient, and it can be very daunting and almost suffering. Okay, the patient basically suffers because their respiratory system has shut down and the delivery of oxygen has stopped. Okay.
I got one more from, and I'll make this for you, Dr. Cook. From NBC News, is IgG still being given for exposed children?
Yes. 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 That is a very strong tool that we have to provide protection after exposure to measles. Dr. Cook was very eloquently explaining the difference between an infant who is 0 to 6 months old, having an immune system that is very much dependent on passive immunity from mother. And so they're not able to mount an immune response to any vaccine. They'll just kind of fight it off. And so that's the highest population who would require IVIG once they're exposed to measles. And it's highly effective. So yes, we still use that.
Okay, this concludes our news conference. Thank you all for joining us today. We had some technical difficulties at the beginning, so if you missed some of this press conference, you can see it at the City of Lubbock website, mylubbock.us/video, and it will be available soon on the City of Lubbock YouTube channel. Thank you all very much.